Dr. Brotzman is the author of the best-selling textbook, Clinical Orthopedic Rehabilitation, which is now in its 4th edition and is an international bestseller for Missy, Harcourt, and Elsevier. It is now translated in 13 different languages.
Good afternoon and welcome to our little didactic here on foot and ankle surgery after you have had your procedure. Unfortunately, the mean anesthesiologist gave you the nice gas during the procedure, but now you're a little woozy, you're a little amnestic. It all made sense when we were talking to you post-op, but you've kind of forgotten it, and you'll be kind of amnestic for the rest of the day. That's okay. This will cover that for you. I've found in my practice of 25 years that there's typically 3 kinds of folks that show up with you to the surgery center to help you. The first one is your husband. He's going to remember about 35% of what we tell him, which is, that's husbands. What can you say? Boyfriend, maybe 45%. Husband, 35%. So wives are going to be much better. They're going to remember about 85%, but they're going to leave out the parts you want, like you need a sponge bath periodically or a foot rub. They're going to leave that out. And then finally, the third one is, your roommate, your next door neighbor, or the Uber driver. They're just going to kind of tuck and roll. They're going to shoot you out the door, and you're in the bedroom, and now you don't know what you're doing. With any of those 3, we want to kind of give you a recap of the things we told you so you'll know what to do after your foot and ankle surgery. So when you get home, one of the first things we want you to do is elevate your foot and ankle above the level of your heart. We're trying to get your venous return to come back to your heart, so we want you to be up nice and high, several pillows. You've got this splint on, and it's not too constrictive. If anything feels tight, you can kind of loosen it up a little bit. The reason we give this to you is we don't want your foot to go down into plantar flexion. We want it to stay in a neutral position so you don't get a tight Achilles. And we don't want this splint to put any pressure on your incision. We typically use this splint when you're hanging out in the bed, taking it easy, watching TV, recouping. But then when you want to get up and walk around, you can't put weight on this. It's too flimsy. So we're going to give you one of these cam boots, which I'll show you in just a second, and you'll switch to the cam boot when you're walking. So splint when you're hanging out in the bed to keep it in a neutral position and not to rub on your incision. And then the boot allows you to walk around, weight bearing is tolerated with your crutches.
But what if I have to go to the bathroom in the middle of the night?
You got one of 2 options. You can take, don't put any pressure on this and keep your foot off the ground. And if you don't feel like you have time to put the boot on, but you got to be careful because your balance is not great with that. Or you've got to take the time, take this splint off and put your boot on. You can also put some ice with an ice bag or an ice sleeve over the area of the extremity that's been injured. So let's say you have an ankle incision over here, you can put the ice here, or you can put it on the front. You never want to have an ice sleeve or an ice bag directly on the skin. You always want to have this ace bandage or a towel between the skin and whatever you're delivering the ice with. The ice gets really cold and it's great for anti-inflammatory for the joint, but it can actually kill the skin or give you frostbite or freezer burn. Typically we'll also let you take the splint off and do ankle pumps to kind of keep your calf moving so that you don't try to minimize your chance of a blood clot. So she can't take this off and pump it up and down, but no side to side, only up and down. We're having her take 1 aspirin a day for the first 2 weeks to minimize the chance of her blood clot unless she has an allergy to aspirin. That's the 325 milligram regular old Bayer aspirin, not the 81 milligram. So 1 of those a day for 2 weeks if you don't have an aspirin issue. If you're already on some blood thinners, then we're going to be doing that per your blood thinner doctor, and don't take the aspirin with that. We're going to have her come to the side of the bed, but she's going to just sit there for a moment and kind of just relax and make sure that when she stands up, she's not going to get lightheaded or throw up or pass out. She's putting her crutches out at the same time as her affected extremity and kind of walking. Weight bearing is tolerated with her crutches. Now, we may tell you no weight bearing on your boot. We'll tell you that post-op, but most of our foot and ankle surgeries are weight bearing is tolerated with the boot and the crutches. Typically, you don't have to change this bandage. We leave it on until you see us back, unless you're spiking temps over 101.5, and then you're going to call us and we're going to check that wound. Right now, we've got her doing it with bare feet, but we usually like to have a shoe on your other foot that's got a little bit of heel lift in it because it evens you out as you're walking. Everybody wants to know when they can do exercise. You can often get on a stationary bike with your other leg and work on your other leg and some upper body stuff, but we don't want you getting super sweaty and getting germs into our incision like staph and strep from your skin. So you got to be kind of light on your workouts in the beginning. One of the other questions is showering. How do I shower or bathe? And the problem is we want you to keep our incision and our boot dry. So some folks will just lay down in the bathtub and put their foot up over the side of the bathtub to keep it dry. Other folks you'll put on like a trash bag and some tape and just keep it out of the stream of water. You just let the shower go, but try not to get a lot of water going down that leg because nothing's perfectly waterproof on that interface. We don't really like anything on the incision. We like it just in its natural state. Dermatologists say you can put a little Aquaphor on there if you want to, but that's probably okay. But typically you're in this bandage until you see us back up for follow-up. So what are my signs of infection? What are things I should be looking for, Dr. Brotzman? There's the multiple W's: wind, wound, water, warfarin. So in the beginning, if you've got a little bit of a low-grade temp, wind means you may have a little atelectasis in your lungs because during anesthesia we're breathing for you. So you want to do some good, nice deep breaths several times a day, nice deep breaths to re-expand your lungs. You can buy a $7 incentive spirometer on Amazon where you suck really hard on the incentive spirometer and that will help you re-expand your lungs. Wound, after several days, you might be spiking the temperature. That could be your incision. It's very rare. It's less than 0.5%, so don't worry every night about is it getting infected. If you're spiking a temp, obviously, over 101.5, you should call us. If it's low grade, keep working on the deep inspirations. The water part of it is a urinary tract infection afterwards. Pretty rare in orthopedics, unless we've got you on antibiotics. Occasionally that happens. And then warfarin is the name for one of the blood thinners. So one of the things we're worried about further down the sequence of your rehab or your convalescence is that you might have a blood clot. Okay, one of the other things we're going to talk about is PRP, which is platelet-rich plasma. So what will happen is when you're in surgery, we draw your blood off and we spin it down and we get just the platelet component of it and we inject it into the areas that we want to, and we will have discussed that. The interesting thing about PRP is we like you to try not to use anti-inflammatories for the first 4 to 6 weeks after surgery because the anti-inflammatories will decrease the effect of the platelet-rich plasma. What are anti-inflammatories? That's like Advil, Aleve, ibuprofen. You can use Tylenol, you can use your pain medications, but with the anti-inflammatories, unfortunately, they will decrease the effect of the PRP. So you're at home, you're taking it easy afterwards. If you're having nausea, you're taking your anti-nauseants. You're elevating your limbs above your heart as much as you can for those first 2 weeks until you see us back to try to get your lymphatic and venous return back. You're icing it to decrease inflammation, but never directly on your skin. You're wiggling your toes some, and periodically you're taking your foot and ankle out of the splint and moving it up and down to keep your venous return coming back to your heart as well, and minimizing your chance of a blood clot. You're taking an aspirin a day, which is 325 milligrams a day for 2 weeks, unless you have an aspirin issue. You're also doing some foot and ankle pumps on your other calf because you can also get blood clots on the other side, surprisingly, from surgery. So you're doing that on your other side. Whenever you get up to walk around, you take the splint off, and if we give you the splint, then you take it off and you put the boot on, and your weight bearing is tolerated unless we change up your weight bearing status, and we'll tell you that.